I want to introduce Erin Duffy. Erin Duffy is a partner with Duane Morris, another, again, amazing partner to so many different entrepreneurs in this region, and we're grateful for their support and specifically of our MedTech series. Erin?
Hi, good morning, everyone. My name is Erin Duffy. I'm a partner in the Health Law Practice Group at Duane Morris, and I focus my practice on, healthcare provider representation as well as medical device and pharmaceutical companies. We thought it would be useful to give you an overview of AvaMed, that is an industry association that is very focused on the medical device industry and the pharma industry and how they are helping the industry during this pandemic. As many of you may know, that their interaction with healthcare professionals is the industry standard, but we'd like to give you a broader overview of what they do and how they are helping the industry. So Ray, can I ask you to introduce yourself first and then Jim?
Absolutely, and I know many of the PAC members because of my history. I was with Bio for 15 years and I've now been with AdvaMed for 14 years. And in that time frame, I brought the Bio conference to Philly in 2005, and our conference was in Philly 2 years ago. And Dean, you and I go back a long way. Bio Advance and many others I've had the pleasure of working with for a long, long time. So I do want to quickly introduce you to AdvaMed, and it's the Advanced Medical Technology Association. It's been that name for 20 years. Some people still remember us as HEMA. We date back before the FDA even started regulating devices. And we traditionally have a board of directors that includes a who's who of the industry. So what we do is we represent the medical device makers, the diagnostic makers, the in vitro diagnostic and digital health companies. And that membership in the local greater Philly area includes J&J, Olympus, Teleflex, Siemens, BD, Integra, Stryker, Gore, Bayer, the big guys. There's a lot of small companies as well, but globally, Boston Scientific and Medtronic, as well as the companies that are in the news almost every day now, the Abbotts, the ResMeds, GE, the QIAGENs, Roche Diagnostic, Biorad, Hologic. So we're the guys that make the ventilators. We're the ones that make the PPE equipment. We're also the ones that make the diagnostic tests, and we are quickly in the whole the digital health space, which is playing a larger role. So if you're a large company, I think we have 25 or 26 of the world's 30 largest manufacturers. We have a large percentage of the companies that have $1 billion or more in sales, but over 200 of our member companies, and we have about 450 members, are more in line with Adam's company and Brian's company, the companies that are pre-revenue or maybe have one product. Our staff is about 85 people. And just to tell you, a little bit about the areas we focus on, I think there's 7 areas of focus. One is regulatory, and we have people that are with the FDA or in the FDA or talking to the FDA on a daily basis. We have a whole department. We have another department that's just in payment and reimbursement, dealing with CMS and Aetna and United and Kaiser and so forth. We have a legal compliance department, and as Erin alluded to, we're the ones that published and created the code of conduct of how manufacturers should deal with physicians and with the interface. We are industry communications, which is the area department Jim runs. We are international, so we do market access issues. We have a business development capital formation team, and then the department I run is our conference meetings and education component. Our CEO has a fantastic background, which has been incredibly helpful through this last episode. He is a former Senate staffer, and he became the chief of staff at the Health and Human Services at HHS. So it's been very advantageous in these past couple months to have a team that regularly works with Congress, with the FDA, with HHS, with the Department of Justice, with the White House, and in growing more so now with FEMA and other organizations we frankly didn't deal nearly with as much. So that's kind of a quick introduction to AvaMed. We're Washington, D.C. based. We fit in, if your hand only had 3 fingers instead of 5, they're really, the healthcare chain is bio and pharma and AdvaMed. And bio represents the biotechnology companies, pharma represents the large drug and vaccine makers, and we represent everybody else. If it's a product that's regulated as device, then we're the trade group. So with that, let me let me introduce myself as well. My background is more politics than science. I have no engineering background at all. I came up as an attorney. I worked in the volunteered in the Reagan Bush campaigns, got picked up and worked for Vice President Bush. I worked for a couple members of Congress, worked in the White House for a short period of time, and left there to get into public policy, and was then went to the trade association route and went through with bio and now with AdvaMed. With that, let me introduce you to the head of our public affairs shop, and that's Jim Jeffries.
Hey everyone, thank you, Ray. Can you hear me okay? There's a great introduction about AdvaMed. I am a former Hill rat, started in 2002 as an intern, came up like most of those folks did. I was on the House side, worked with House leadership under Deborah Price as the conference chairwoman, went away briefly to work for a polling and strategic language research firm for a while, and then spent the last 8 years on the Hill as head of communications for Senator Alexander and the Health, Education, Labor Committee that he runs. Actually helped to publicize and do the public affairs work surrounding 21st century cures, which bears heavily on our industry. And then left for a quick, 2-year jaunt with Paul Allen, the former late co-founder of Microsoft, owner of the Seahawks, Trailblazers. It was a wild couple of years with his various philanthropic projects trying to save elephants in Africa, and launched the biggest airplane into the upper atmosphere to send satellites around the globe. So it was a lot of fun, but I find myself back here, been with AdvaMed for about a year, although over the past month or two with dealing with COVID, it feels like it's been more like 4 or 5. But let me go ahead and share my screen and give you a little bit better sense of okay, what we do here, and exactly what our role is here in the crisis. As Ray mentioned, the way I like to think of what a trade association does is that we are the industry's first line of defense and offense with all regulatory bodies. So our goal is to ensure that the best interests of the industry are made known, and that we work to advance policies at the local, state, and global level. And then I think probably the other half of the association's role is to publicize and to defend and promote the industry and the public. And obviously we find ourselves in the thick of both of those important roles right now during the COVID crisis. So our key goals during this crisis are first to meet the needs of the member companies as they struggle to deal with shelter-in-place policies, as they struggle with a drop in business as a result of, for example, the pause in elective surgeries. And so we help internally our members to navigate those very difficult issues, along with other industries and every other American who's moving through that. But then we also are very heavily focused on ensuring that through our policy work, that FDA is moving as quickly, but without sacrificing safety and efficacy concerns to approve devices and get them out on the market. The testing that you all are seeing, we had our first test approved on March 12th. We've since had 30 approved and are ramping up to produce 28 million tests by the end of this month. And so that's in large part because of our work with FDA to help ensure that they are moving as quickly and as safely as possible through these authorizations to get these things to market. We also are working closely with the administration through the task force to ensure that the Defense Production Act, if it is invoked smartly and efficiently and in a way that does not impede our company's work to get these products to market. And we're working with the Hill as well to ensure that the stimulus packages, now they're on COVID-4, as you probably have heard in the news, that these stimulus packages also include much needed help for the hospitals and for the med tech companies who are providing this equipment to keep Americans safe. And so we did, in order to accomplish that, we took some pretty serious actions internally. We reorganized the organization with probably a 90% focus on the COVID crisis. We've established multiple internal task forces to focus on issues such as supply chain, global affairs issues, public affairs, and government affairs. And each of these task forces is focused on all of the various narrow but important interests of our member companies as they mobilize. Now, the public affairs strategy, you may wonder why this presentation is so important or so heavily focused on public affairs. And part of the reason is that we find ourselves in a very unique crisis in the medtech industry. Generally, crises, you're trying to prove to the world that you didn't do something, that you didn't take some sort of illegal action. We find ourselves in a unique crisis where we're attempting to show to the American public, to regulators, to the White House, and to Congress that we are doing something, that we are mobilizing 24/7, repurposing production lines, hiring new employees, training new employees, doing the best that we absolutely can to produce the PPE, the ventilators, and the testing necessary to get us out of this mess. And why that's important goes back to our work with the Hill and the potential use of the Defense Production Act. We want to ensure that there's no need for a takeover or any other use of the Defense Production Act on the production side of our companies to get them to do more. As Dr. Giroir put it in a White House press conference the other day, he says that he sees the Defense Production Act as sort of a carrot and a stick. On the one hand, you can use that act to compel a company to do something, but what he wants to and prefers to do is to use it as a help up. So we, at AdvaMed, see it as our role to very strongly advocate for uses of the DPA that help us and not hinder the work that we were trying to do. And so we're doing that through several key messages. We've got a strong paid, earned, and owned media strategy in place. And we are focusing on mainstream media. I'm sorry, did I hear a?
No, can you enter the question? We're not able to enter questions, so can you ask the question?
Oh, so the question, I'm sorry, the question that was typed in that I just answered, the line didn't go back. I'm sorry, Danielle, help me out. Am I missing something?
Nope, keep going. Apologies for that.
Okay.
So we're working through a strong three-pronged strategy to ensure that our message gets out there, to ensure that member company efforts are loud and clear in the media. Over here on this slide, there's a lot of information, but really the key here on the right is that the COVID-19 conversation in the media is almost entirely focused on the actual medical equipment that we need. There's very little focus on hospitals, on doctors. You can see through this wheel, this inner wheel is when face masks are mentioned. Behind it are some of the subtopics that come up, but you'll see that on each of these topics where you search for Trump or you search for face masks, the vast majority of the terms that come up are related to our industry. And so we've been working through various, like I said, channels, our social media, our earned media, interviews, graphics that we've created to show. For example, this one on the right made a big splash a couple of weeks ago when people were very concerned about ventilator availability, to show that our companies have mobilized from pre-COVID production of about 700 a week, going up to about 10,000. This graph is now outdated, even after 2 weeks, as companies project they'll be able to produce up to 10,000 a week. We did the same thing yesterday, released a graphic on commercial test availability as we enter this final phase and most crucial phase that everyone sees testing as the way out of this. And so we are working very hard to ensure that people recognize that MedTech is doing everything that it possibly can to produce both the live virus, serological, and antigen testing that we believe is kind of the triple crown for getting us out of this mess. And then finally, you know, we do a very good job of ensuring that all 400 plus of our members have the resources they need. We've developed a pretty robust website to help them understand where they can get help, how they can be help, you know, how the government can help make them whole as they suffer through the shutdown with regular updates. And so with that, I think I'll turn it over for any questions folks might have for Ray and I.
Yeah, and maybe I was going to say
I
that
was just saying,
the questions I've had talked about, you know, some of the things that are happening, and I will give a, you know, early on, like, you know, because of the dialogue, because of who we are, and because people come to us instead of, you know, going to, you can't go to hundreds of companies and ask how you can help them or what needs to be done. You know, the dialogue has been around, for instance, a product that we might need in the US that doesn't have an FDA approval but has a CE mark. Well, can we bring that product into the US right now because of a critical need? Or we find out that there's certain parts of the country or even outside of the country where an action is quickly taken that locks everyone down into place. And we've got a company that might be producing swabs or is producing a key component to a ventilator. And that company, all of a sudden, their employees are not able to go into work, and yet they have to go to work. So then we might quickly make a phone call. We might literally call the vice president's office. The vice president's office calls that governor or foreign official, and that company is back working again quickly because of the strength of an association versus them individually trying to figure out how do I get myself to the top of the government chain to reopen my business. So in some ways, it's safety in numbers, and that's what's been happening. People come to us and they say, hey, I've got a critical component or I've got a critical product and I'm being blocked for this reason. And then we can raise that reason with officials, and we often are they're getting a much quicker response because of the association. And it's been so encouraging. I am so proud of our industry because what I'm seeing, there's no competition. It's all cooperation right now. We've had member companies that are contract manufacturers or producing a product that say to us, let others know that I've got excess capacity in my plant. Well, all of a sudden that plant is now producing a product that's needed. And, you know, we just quickly are matching people up. So anyway, let's be quiet and see if there's some questions. I know Erin's got some as well for us.
yeah, there's a huge surge in makers and maker spaces who work to try and address PPE needs. It appears to be a great benefit to having a central point where some of the level of communication about processes, plans, needs, and also sharing best practices and events and advancement. Is AvaMed connected or working to connect with them?
So AvaMed, we now have a COVID-19 response website that I think is probably the best thing. People can connect through there. We've got, I don't know how many, maybe Jim can help me, how many COVID-19 response teams that we have. So the answer is yes. It is, we are fielding calls and assisting whether they be members or not, if they're part of the process that can help us address this need and need either advice or counsel or someone to point them in the right direction. We're attempting to help any and all folks who are coming with products and to address these needs.
Right. So we do have it there. There's a task force within AdvaMed that specifically focuses on inter-industry, meaning, you know, other industries coming to us saying, how can we help? We make textiles, we make curtains, you know, is there anything that we can do? And so we have a task force within AdvaMed that helps make those connections with member companies to get best practices and increase that production.
And AvaMed also has an educational component and does conferences and things like that that are sort of outside of the COVID-19 space, which is obviously taking the precedence here. But Ray, how has that changed the programming or the thought on AvaMed going forward?
Oh, it's been the three industries you don't want to be in right now: the cruise ship business, the assisted living business, or the conference businesses. I mean, as bad as it is that elective surgeries are on hold, nobody's been to a face-to-face conference since the middle of March, and we don't know when that will next be. And yet it is critical that we have programs like this, particularly programs that are going to help people with best practices on how to, how do you let your folks into your building? How, the issues that we're going to be facing, and, as sales reps are going to have a tougher time getting into hospitals, how are they going to have to change? How do we educate our current sales force and work with the hospitals to learn how we're going to be doing business in the new normal? So we have to have conferences to do those things. What we're currently doing is going all virtual, just like this. We are still planning to do face-to-face come the fourth quarter of this year, and our biggest conference is in October, so we're hoping that's gonna be safe to be held. But we do now so many webinars. Almost all of our COVID task forces, they're meeting. We're all using same systems. We're doing Zoom. We're constantly bringing people together because the group think is so much better. And it's all being done right now through technology, much like you're doing, Dean and Danielle. But we do hope to resume because we think it's critical. Our industry has to communicate with each other. One company cannot stand alone right now. This is probably the best example of both public-private partnerships that I've seen in all my years, and I've been in Washington, D.C. most of my life. So meetings and face-to-face are critical, but in the interim, we're doing just what you're doing, just bringing people together like this. And our board of directors, instead of meeting once a quarter, is now meeting twice a week. It's been incredible, and they're all meeting much as we are right now by technology.
And at a high level, I know that everyone is focused on the testing piece of things. Have you seen anything, or has AvaMed seen anything with regard to the tracking and tracing, which is also seems to be one of the key components of reopening a lot of the economy?
Yes, and I'll have Jim jump and help me, but we've seen it. It seems to, it's like chess or checkers. It started out, we had to react right away, and the whole focus was on ventilators. And then as that started happening, we saw some supply chain issues there. It shifted to the diagnostics. We need the diagnostic testing before the vaccines and so forth come along. The next thing we've got to do is to be able to track. Yeah, if we can figure out who's got the virus, how do we make sure we know where they are and who they touch, and how we can, so that area, and the policies now have all went at first to help ventilators be made and help allow CE marked ventilators to come in. The next was to get help, as Jim mentioned, to help, you're making carpets and all of a sudden. So now that's what the focus is, and the whole telehealth, which has dramatically changed, will never go back to the way it was in tracking. And there's companies out there that are pivoting to be able to develop these products. And we are centrally involved to try to help them navigate whatever regulatory path they have to get those products out and marketable. Jim, do you have anything to add?
No, I don't. I think we provide the technology for that testing. The track and trace aspect of it would probably fall into more of the public health, FDA/HHS side of the equation. But certainly our companies are involved in producing that technology and ramping it up quickly.
Okay, great. Thank you. I mean, does anyone else have any questions that they'd like to ask Jim or Ray?
Well, everybody, if you're interested, advamed.org, advamed.org. You can access our COVID-19 site there. And we're right down the road. We love PAC. We love the Philadelphia community. If there's anything we can do, please reach out to us.
Thanks for having us.
Ray, Jim, thanks so much for participating this morning and for all you're doing for the industry. A lot of people don't know all the behind the scenes advocacy work that happens in normal times. In these times, it's critical. And just really appreciate your participation here this morning your advocacy, but also your advocacy for our region. You've been strong supporters of what's been going on in Philadelphia for a long, long time. So we're thankful and grateful for that.
Yeah, we appreciate it. Thank you.
You bet. Thank you all.
Also want to thank Erin Duffy and Duane Morris, and Erin's partners, including Sandra Stoneman, a board member at PACT. So again, Erin, thanks for your participation here this morning.
Thank you for having us.
A reminder, please do use the Q&A to post any questions that you have. We do have, again, another session here left. We talk about big company involvement. We had some presentations from some earlier stage companies a little earlier this morning. We have some terrific big companies involved in our region, and one of those participating this morning on the webinar is DSM. So just want to call them out. They've been a terrific supporter of the medical technology world and PAC, so thanks to DSM. Also want to thank Eisner. Eisner, also one of the sponsors here this morning, who's not participating in a moderator position, but Pat Boyle, who sits on the PAC board, is also chair of this year's PAC Capital Conference. Ray Briscuso just talked about in-person meetings for the fall, and as you all know, we have on the calendar our PACT Capital Conference, our 27th annual PACT Capital Conference for September 24th. We'll soon be opening registration for entrepreneurs to pitch at that, and are certainly hopeful at this time that we'll be able to do that live. But as you know, we are constantly and currently pushing the envelope in terms of virtual technologies, and we'll do so for all of our various events in between now and when we're able to meet in person.